Hello everyone, my name is Dr. Anand, your Pediatrics faculty. First of all, thank you so much for all the love and support. Our podcast series and these videos are so highly appreciative. Thank you so much. Today's topic of choice we're going to talk about is cardiology. And in cardiology, the topic of choice is Patent Ductus Arteriosus. Yes, today's topic of choice is PDA, that is Patent Ductus Arteriosus. So first question we have over here is regarding PDA. Number one, PDA, is it a left to right shunt or is it a right to left shunt? So please remember, patent ductus arteriosus is a left to right shunt. It is a left to right shunt. The next question we have over here is it a cyanotic congenital heart disease or acyanotic congenital heart disease? So patent ductus arteriosus, remember, it is a acyanotic congenital heart disease. Next question, third MCQ. Is this a congenital heart disease with plethoric lung fields or oligemic lung fields? So what is the meaning of plethoric lung fields? So please remember, plethoric lung fields means increased pulmonary artery blood flow and oligemic means decreased pulmonary artery blood flow. So what do you think? This patent ductus arteriosus, is it a plethoric lung field condition or oligemic? The answer is it is a plethoric lung field condition. That means increased pulmonary artery blood flow. Next question, very common question they ask in exam. PDA, patent ductus arteriosus, it is present between what and what? Is it present between the pulmonary artery and which aorta? If I ask you a question, pulmonary artery and ascending aorta, descending aorta, or which aorta? So please remember, very importantly, patent ductus arteriosus, it is present between the pulmonary artery and descending aorta. So quick revision, let's go one by one. Number one, PDA, it is a left to right shunt, acyanotic congenital heart disease with plethoric lung fields, and PDA, the connection, it is between the pulmonary artery and descending aorta. Now, if I want to close the PDA, there are two top class questions which we ask in exams. If you want to close the PDA, which drug will you give? If you want to keep the PDA open, which drug you will give? So please remember guys, if you want to close the PDA, the options we have is ibuprofen, indomethacin and paracetamol. So ibuprofen, indomethacin and paracetamol, these three are the choices we have if you want to close the PDA. And if you want to keep the PDA open, what do you want to give? PGE1 analog or PGE2 analog? Please remember, you will give PGE1 analog and the drug is L-prostadil. Yes, exactly, it is L-prostadil. And please remember, what about PGE2? In the mummy's tummy, in the fetal circulation, placenta secretes PGE2. PGE2 is endogenous in nature. So placenta secretes PGE2, which keeps the ductus arteriosus open. Once the baby is out, placenta is cut. And once the placenta is cut, automatically PGE2 levels goes down, and that is how the ductus arteriosus closes. So these are the beautiful points. Must appreciate for exam purpose. PDA, it is a left to right shunt, acyanotic congenital heart, increased pulmonary artery blood flow, and very important, in PDA, do you see narrow pulse pressure or do you see wide pulse pressure? So please remember, what is pulse pressure? The difference between systole and diastole, that is known as pulse pressure. And in patent ductus arteriosus, you will see a wide pulse pressure. Please remember that. These are the beautiful top class points we have on PDA. And last but not the least, I have a question for you guys. You tell me in the comment section about the functional and anatomical closure of PDA. This was a last year PYQ. So previous year question I'm asking you, very important. When is the functional and anatomical closure of the PDA? Let's see how many of you answer, in this comment section. Thank you so much everyone for all the love and support. And before leaving, the quote for today is, it's okay if you don't like me. It's okay if you don't like me. Not everyone has a good taste. So think about it. Message to your friends, the one who don't appreciate you or don't like you, that it's okay if you don't like me. Not everyone has a good taste. So please take care. Thank you so much and bye-bye.